Hello, everyone, and welcome to this week's NDARC webinar. My name is Olivia Price, and I'm a PhD student here at NDARC, and it's my pleasure to be hosting today's webinar. I'd like to begin by acknowledging the Gadigal and Bidjigal people as the traditional custodians of the land from which I'm joining this webinar. I'd also like to acknowledge the traditional owners of country throughout Australia, noting that our speakers and audience are joining from many different locations across Australia today. We pay our respects to the elders past and present and extend that respect to any First Nations people present today. Now it's my great pleasure to introduce today's speaker, Dr. Mark Robinson. Mark is a Senior Research Fellow at the Institute for Social Science Research and an Honorary Senior Research Fellow at the University of Glasgow. He is a public health and evaluation specialist interested in understanding, influencing, and evaluating the social, economic, and commercial determinants of health and health inequities. In today's webinar, Mark will discuss minimum unit pricing for alcohol in Scotland, from formulation to evaluation via the UK Supreme Court. I'm excited that during question and answer time, we'll have the opportunity to hear from Associate Professor Sarah Callanan from the Centre for Alcohol Policy Research at La Trobe University. Sarah is a quantitative researcher whose research primarily uses survey data and focuses on drinking in the home, alcohol and pricing, and screening tools. Mark and Sarah will take questions from the audience after Mark's presentation, and you can log questions for them using the Q&A function in Zoom. I'll relay as many questions as possible to the speakers at the end of the presentation. But that's enough from me. So Mark, I'll now hand over to you and ask you to turn on your camera and start presenting.
Okay, great. Thanks, Liv, and good afternoon, everyone. Thanks for joining today's webinar. And a massive thanks to Amy and the NDARC team for inviting me to present as part of this webinar series. I've been watching these webinars for many years, I think, even before I moved to Australia. I was watching them, so it's a real privilege to have the opportunity to present myself. And so for the next 35 minutes, hopefully, I'm going to share with you a bit of a story that I was lucky to play a reasonable part in, which for me spanned over a 10-year period, about 13, 14 years, and which last year in many ways entered its final chapter. And like all good stories, this one had many twists and turns and multiple characters, so some good guys and some bad guys, arguably. And that story, as Liv said, is about minimum unit pricing in Scotland, from formulation to evaluation. Before I tell that story, I'd also like to acknowledge the traditional owners of the various lands from which everyone is joining today. I'm in Brisbane, or Meanjin, on the lands of the Yagara and Turrbal peoples. I would like to pay my respects to their elders past, present, and emerging, and to extend that acknowledgement to any Aboriginal and Torres Strait Islander people who might be joining today. And I thought I would start just by telling you a wee bit about where I'm fae, which in English translates to a little bit about where I'm from, which of course is the setting of this story, which is beautiful Scotland. So very briefly, Scotland is a high-income country. It has a population of about 5.5 million, which interestingly is very similar to Queensland, where I now live, in terms of population size. But in terms of landmass, it's obviously very different. Scotland's landmass accounts for about 5% of Queensland's. Scotland is a really beautiful, picturesque country. This is a picture of me in the middle, out hill walking, looking for the Loch Ness Monster with my kilt on and my bagpipes with me. Yeah, taking in the beautiful scenery. But aside from its beauty and aside from its wealth and its stereotypes, Scotland is a country with quite deep and enduring social challenges and social inequities. And over many years, these have resulted in Scotland having a lower life expectancy and wider mortality inequities than any other Western or Central European country. So for many years, Scotland has had the unenviable label or the unenviable tag of being the sick man of Europe. And the contribution that alcohol made to Scotland's poor health profile was first kind of nationally recognised in the mid-2000s when epidemiologist David Leon and Jim McCambridge published what has become a really seminal paper in the Lancet in 2006. And what it showed was that rates of liver cirrhosis mortality, which is a really good indicator of population levels of alcohol-related harm, had increased quite dramatically across Great Britain during the 1990s. So in this chart, Scotland is in red and England and Wales is in blue, with men on the left and women on the right. This increase was particularly marked in Scotland, and importantly, it was against a backdrop of falling rates of liver cirrhosis mortality in other European countries. And subsequent analysis of similar administrative data within the UK showed that that 15 of the 20 local authorities across the United Kingdom with the highest rates of alcohol-related mortality were located within Scotland. And a Scottish burden of disease study found that 1 in 20 deaths in Scotland using data from 2005 were either wholly or partially attributable to alcohol. So at that time, during that time period, there was a lot of evidence being produced, a lot of research being produced, which was leading to alcohol in Scotland and the problems that alcohol was causing, hitting the media headlines. And it was increasingly being recognised as a major public health concern. And in response to this national concern, the Scottish Government, led by a minority SNP administration, introduced its strategic response, which was its 2009 framework for action called Changing Scotland's Relationship with Alcohol. Now, to their credit at the time, the government adopted an outcomes-focused planning approach to developing the actions within that particular framework, and also used evidence-informed logic models. And what that led to was 41 evidence-informed outcome-focused actions. So the overarching intention of the framework was to reduce population levels of consumption and related health and social harms. And part of this suite of 41 actions included 2 actions which related directly to the WHO's kind of best buy of alcohol affordability. And that was first a ban on multi-buy promotions of alcohol, and of course, the topic of today's conversation, minimum unit pricing. And I should also mention that the framework also included a very strong commitment to monitoring and evaluation, through which a new programme of work led by then NHS Health Scotland, now called Public Health Scotland, which was called MESAS. So MESAS stood for Monitoring and Evaluating Scotland's Alcohol Strategy. And that programme of work was established at the time of the framework. Now, I'm sure most of you now know what minimum unit pricing is, particularly if you tuned in to Nick Taylor's excellent seminar or webinar a few months ago as part of this series. But just as a quick recap, particularly in a UK context, MUP is a floor price below which alcohol cannot be legally sold within licensed retailers. In the UK context, alcohol content is measured according to alcohol units, hence minimum unit price. And an alcohol unit represents 10 millilitres or 8 grams of pure alcohol. In Scotland, the MUP was initially set at 50 pence per unit. The primary purpose of minimum unit pricing, consistent with the purpose of the framework for action, is to reduce levels of population alcohol consumption while targeting those who drink at hazardous and harmful levels. So it does have that targeted element to it. And that's because those who do drink at hazardous and harmful levels tend to drink alcohol that is cheap relative to its strength. Just in terms of a bit of a timeline, the initial minimum unit pricing bill was actually passed as legislation by the Scottish Parliament back in 2012. but due to a legal challenge led by the Scotch Whisky Association and various industry partners, it wasn't implemented until the 1st of May 2018, following a UK Supreme Court judgment, which I'll say a bit about later on. So this was very disappointing to the public health community within Scotland, especially those of us who were in the parliamentary chamber when it was passed as legislation. It felt like a very momentous occasion, and we were all very excited about the prospect of evaluating what impact the legislation would have. But nonetheless, in this interim period between the legislation being implemented, or it being passed and then being implemented, we delivered, as part of the messiness programme, a comprehensive suite of monitoring and evaluation studies. Some of these were on key actions of the framework, and others were bespoke research papers to better understand the problem of alcohol and Scotland's relationship with it. We also produced annual monitoring reports in which we kind of brought together, compiled, analysed and presented the most robust data available on a range of indicators related to alcohol consumption, as well as health and social harms. In some ways similar to ENDARC's drug trend series, which I know happens every year and consistently gets good media coverage and good policy impact. So this was somewhat similar in that regard. In addition to using data that was already available, we were also tasked with scoping any new data that could be used to better understand and communicate alcohol consumption and harm within Scotland. And this led to the purchase of objective alcohol retail sales data. And this was a real game changer in terms of measuring population consumption within Scotland and the rest of Great Britain, that being England and Wales. Sales data are recognised as being the gold standard approach for measuring and monitoring population consumption. And with these data, we were able to show that the volume of alcohol being sold per person in Scotland was about twice as high as that which was being self-reported by people in Scotland. It also showed that 20% more alcohol was being sold per adult in Scotland compared with those in England and Wales, despite survey data not suggesting any real difference between the countries. And the granularity of the data also allowed us to show that this 20% higher volume that was being sold was almost entirely attributable to alcohol being sold through supermarkets and off licenses, so through the off trade. We were also able to obtain data on the volume of alcohol being sold at different prices in Scotland and England and Wales, the so-called price distribution data. And using those data, we were able to show that the majority of the higher volume of alcohol being sold in Scotland through supermarkets and off licenses was alcohol that was being sold cheap relative to its strength. So predominantly within this 35 pence to 50 pence per unit price range. And this was really driven by higher sales of spirits, particularly vodka in Scotland, and also cider, cheap cider and perry. So these data, these sales data and the price distribution data became a really key and prominent feature in our annual monitoring reports. And they were always met with considerable political, industry and media interest and scrutiny. And so the idea that Scotland's alcohol consumption was potentially problematic in terms of its harm profile was consistently permeating the public and the political discourse. And so by the time that the UK Supreme Court judgment happened in November 2017, so this followed 3 other domestic and European court appearances for MUP, we had an abundance of additional evidence that further supported the scale and nature of Scotland's alcohol problem. And this was heavily cited. So this evidence that we produced over that interim period was heavily cited in the legal documentation that supported the judgment. And very importantly, a key factor in that judgment was the inclusion of a so-called sunset clause. So this sunset clause stipulated that the MUP legislation would cease to exist, i.e. it would be discontinued after 6 years of operation unless the Scottish Parliament voted for it to continue. To inform this vote, there was a requirement for a review report to be delivered after 5 years, a review report that assessed the operation and effectiveness of the legislation. Did it work? Did it have its intended effects? And to inform that report, Public Health Scotland, the organisation that I worked at, was tasked with designing and delivering a 5-year evaluation of minimum unit pricing, building, of course, on the directly relevant experience that we'd had between the bill being passed and the legislation actually being implemented. So that delay was not what we wanted, but it was helpful in some ways. Now, as with the evaluation for the overarching framework delivered through the MESAS programme, the minimum unit pricing evaluation was planned around a stakeholder-informed theory of change, which is on your screen now. So the theory of change is quite high level and presents a kind of logical, a plausible chain of outcomes whereby successful implementation of MUP will result in the increased price of low-cost, high-strength alcohol. This, in turn, based on extensive evidence, we hypothesize would reduce population alcohol consumption and lead to safer patterns of drinking. And this, again, in turn, would reduce the health and social harms caused by alcohol consumption. In addition to this main sort of causal pathway, the theory of change also recognised and tried to demonstrate how a number of other factors might interact with minimum unit pricing and have an impact on either implementation or intended outcomes. So this could be things like disposable income that could affect the affordability of alcohol. We didn't predict a global pandemic at the time of developing the theory of change, and I can say a bit more about how we handled that later on. We also looked at the potential adverse consequences of the policy. So, for example, displacement of spending by individuals who consume high levels of alcohol, substitution from alcohol to other substances, perhaps drugs or non-beverage alcohol, for example, and either an increase or a decreased demand for services. So all of these were really important as we designed a portfolio of studies to try and test and validate whether or not this hypothesized theory of change was consistent with what actually happened. The two overarching questions that we were trying to answer, the two key evaluation questions for this programme of work were, to what extent has implementing MUP in Scotland contributed to reducing alcohol-related health and social harms? And secondly, are some people and businesses more affected, either positively or negatively, than others? The portfolio of studies that were developed included 12 that were funded by Public Health Scotland and either delivered in-house or commissioned to external researchers who conducted that research on our behalf. We also supported other researchers who were funded through external research grants. And that's a timeline of all of those studies is presented on your screen now. For the in-house and commission studies, we published a protocol for the evaluation overall, and a protocol for each individual study was also published before the study commenced. So the governance was really tight, and there was a real principle of transparency that was maintained throughout the whole course of the planning and delivery of the MUP evaluation. So, I mean, I think it's fair to say that MUP in Scotland is one of the most comprehensively evaluated public health policies in recent times. The culmination of all of this work, all of those studies that I just presented, were presented in the final report, which was published in June of last year. And in total, there were findings from 40 individual studies. So that included the in-house commission stuff, as well as the external research grants that we supported, but a whole range of other studies that have been conducted that Public Health Scotland was not involved with. Consistent with all the individual studies, a very rigorous approach was adopted for synthesizing the findings within the final report, and it's a very good read for those of you who are interested. The authors draw on process tracing and contribution analysis and other theory-based approaches to evaluation in order to assess the evidence and to reach their conclusions. And the purpose of the rest of this presentation is to provide you with a snapshot of some of the key findings, and I'll structure them against the sort of pathway of the theory of change. So the first step in the theory of change is implementation and compliance, or policy fidelity, if you like. So in other words, to what extent was the legislation implemented as intended? There were 13 studies that provided some evidence to answer this question. The most targeted of which was an in-house qualitative study in which we interviewed 20 licensing standards officers in Scotland responsible for regulating how alcohol is sold among Scotland's licensed retailers. That particular study found that the policy was implemented as intended and compliance with MUP was high. And that's a conclusion that is supported by a range of the other studies that touched on compliance in one way or another. There were some issues of non-compliance. There was some ambiguity around the use of vouchers, the need for dual pricing within the wholesaler context, for example, but these were generally considered to be minor and to be responded to and resolved pretty quickly. There was no evidence to suggest that MUP led to increases in illegal alcohol-related activity, such as the sale of illicit counterfeit alcohol. And the kind of threat of mass cross-border purchasing, so swathes of Scots going over the border to buy cheap alcohol from England, which was pushed extensively within the media, was unfounded. There were some individual examples of that, but it was generally concluded that it in no way could impact on the population level outcomes that have been seen. So the policy was implemented as intended. We would then expect the price of alcohol in Scotland's off-trade sector to increase, and this is certainly what was observed. There was strong and consistent evidence from quantitative studies from a range of different sort of authors and academic centres of an immediate increase in the average price per unit of alcohol sold through Scotland's off-trade, and importantly, relative to other parts of Great Britain. Changes in the average price were driven by particular drink types, so those that were sold furthest from the minimum unit price of 50 pence per unit prior to the legislation saw the greatest price increases. As I mentioned earlier, that's own brand spirits, cider and perry. This is an example from one of the first studies that was published in the academic literature by Amy O'Donnell and colleagues in the BMJ. They used controlled interrupted time series models on alcohol purchasing data from a household panel from Kantar. This is a market research company. And as you can see, there's a step change in the average price of alcohol in Scotland, and this is accounting for the change for the trend in England and Wales. And it equated to about 5 pence per unit, a 5 pence per unit increase. And that was in the 8-month period after MUP was implemented, so to the end of 2018. And there were other studies which have shown some similar results and also shown that that increased price was maintained over a longer time period. Using the price distribution data that I mentioned earlier, it was found that in the 50 to 65 pence per unit price range in Scotland, this accounted for about 2/3, 65% of all alcohol being sold through Scotland's off-trade 12 months in the 12-month period after MUP. the 12-month period before MUP, it was sitting at about 32%. So that relative percentage doubled in that 50 to 65% pence per unit price band. And the distribution in Scotland before MUP was very similar to that in England and Wales, even though the volumes being sold were different. The change in the distribution is much more stark for those drink types that I just mentioned. So those that were sold in greater volumes below 50 pence per unit, so a much starker change in their price distribution. And all of those charts and data are publicly available. Importantly, there was little evidence of much of an impact on the price of alcohol being sold at the higher end of the price distribution, so 65 pence and above. So on to consumption, and consistent with decades of evidence that increasing alcohol prices is associated with reduced consumption. This is what the MUP evaluation studies also showed. There was strong and consistent evidence of a reduction in population alcohol consumption as measured by alcohol sales, the gold standard, or by alcohol purchasing data. This is an example from a study that I led using the retail sales data. We did some controlled interrupted time series analysis that accounted for the seasonality in alcohol sales, as well as temporal trends, and also controlled for sales in England and Wales as the main control group. And we demonstrated that MUP was associated with a 3.5% reduction in off-trade sales in the 12-month period after it was introduced. Spirits, beer, and wine are the major drink categories. They account for about 90% of all alcohol sold through Scotland's off-trade. And so any relative change in those categories represents a reasonable absolute change. And so for spirits, there was a 6% reduction in spirit sales associated with MUP being implemented. There was less evidence in terms of the direction of effect for wine and beer. For wine, some suggestion of a slight increase in off-trade wine sales. And for beer, again, not statistically significant, but the direction of effect is downward. This analysis, I should mention, was extended to the 3-year period post-MUP, and those results are presented in the final report. The results are very similar and will hopefully be published in addiction very soon. These are the kind of smaller drink categories, but those which tended to be sold at the lower prices and favoured by the more harmful drinkers. So we see much higher relative effects for these drink types. So for cider, we saw a 22% reduction associated with MUP. And for perry, which is a fermented pear drink, we saw a 42% reduction in perry sales. Now, one of the major limitations of the alcohol sales data is that they can't be broken down by population subgroup. So we can't look at the differential impact of MUP on different subgroups of the population using these retail sales data. But based on studies that could do that using purchasing data, so again, back to the O'Donnell paper here, it was clear that the greatest effects on household consumption were among those households that were purchasing the most alcohol prior to MUP implementation, with much smaller or negligible effects on those that typically purchase less. Now, of course, there may be effects at a more individual level that are masked in such quantitative evidence because they did not happen on a sufficient scale to be detected, but which may have important public health implications. And we used specific qualitative studies to try and obtain insights into the lived experience of MUP. And these identified a range of effects, including changes in the type of alcohol that was being consumed. So, for example, in a study on young drinkers, a youth worker commented that I think we've seen a change in young people drinking spirits now. They have swapped cider for vodka. I don't think MUP has put people off drinking just what they drink. So the general perception among young people was that price wasn't a massive factor in terms of their decision to drink, but because of MUP, it led to a change in their drink preferences. Among those working with families affected by alcohol, it was reported that MUP helped to reduce consumption for some, but not for those with alcohol dependence. And this aligns with the findings from a study on drinkers experiencing homelessness led by Carol Emsley and her group at Glasgow Caledonian University. So one participant who experienced homelessness remarked on MUP, no, we don't discuss MUP at all. We might moan about it like the prices went up, but we don't moan about minimum unit pricing per unit. That's not a conversation people have. So people can be aware of changes in price, but weren't necessarily attaching it to minimum unit pricing per se. Okay, on to the raison d'etre of the MUP legislation, which was its effect on alcohol-related health harms. This was the primary purpose of minimum unit pricing being introduced in Scotland. And there were 8 studies that provided some evidence in relation to MUP's effect on health harms related to alcohol in Scotland. But the core study was the use of administrative data to understand the impact of MUP on alcohol-related deaths and hospital admissions in Scotland. And so using monthly data on deaths and admissions that were wholly attributable to alcohol. So the language can be somewhat ambiguous around this, but so this is conditions that without consuming alcohol you would not experience. So we looked at monthly data on wholly attributable conditions from 2012, so quite a long pre-intervention time period, to a 32-month period after the legislation. That was as far as we could go to still get the data, analyse it and report on it before the final report was due. And what we found was that MUP was associated with a 13% reduction in deaths that were wholly attributable to alcohol, and a 4% reduction in hospital admissions, although that estimate was less certain than for deaths. And in absolute terms, this translates to over 400 hospital admissions and 150 deaths being averted due to MUP. Really importantly, from a health inequities perspective, the reductions were largest among those living in Scotland's 40% most deprived areas, who are the population who experience the greatest health burden due to alcohol. And the reductions were also largely due to chronic conditions such as alcoholic liver disease. And in fact, these were slightly offset by slight increases in harms from acute conditions such as alcohol intoxication. But for those acute conditions, there was considerable uncertainty around the findings because, especially for deaths, because a relatively small number of deaths are due to acute causes. I didn't mention this earlier with the consumption studies that we led, but we conducted a huge number of sensitivity and falsification analyses in order to stress test these results, and to test some of our assumptions and methodological decisions. And the results were always very robust to these additional analyses. As you can see, the findings were published in The Lancet and also received global media interest at the time of publication and direct comment from Scotland's, at that time, former and current First Minister. There's now a new First Minister in Scotland. In terms of other population level health outcomes related to alcohol, the MUP was expected to have an impact on. There was no consistent evidence that MUP had an effect on ambulance call-outs related to alcohol, on emergency department attendances, or on the prescription of medication for alcohol dependence. And just finally, in terms of some of the main results, as I mentioned earlier, the theory of change acknowledged the potential for MUP to affect wider social outcomes. And in relation to these, there was no consistent evidence of either a positive or a negative impact on alcohol-related crime or illicit drug use at a population level. However, there was some evidence to suggest that for some drinkers, especially those with alcohol dependence, and particularly among the financially vulnerable, that there was a deepening or an exacerbation of pre-existing harmful strategies, such as reducing spending on non-alcohol essentials, such as food or energy bills and so on, as well as seeking help from charities or borrowing money. One participant in the large harmful drinker study that Don Holmes and his team in the University of Sheffield led, one participant said, so we went to quite a few food banks, which I feel bad for, do you know what I mean? But I was always honest with them that we spent it all in drink. So again, just reinforcing at that individual level, there were some unintended adverse consequences. And the drinkers experiencing homelessness study, one participant said that since the drink prices went up, people are turning to other things. See, just in the last 2 months, I've lost 4 of my pals, and they've all passed away with taking Valium. These are guys that were on the drink. So again, a suggestion that there was not substitution, and we didn't find much evidence of people who drank alcohol completely, who hadn't taken drugs before, substituting to drugs. But there were some suggestions that people who were drinking maybe supplemented some of that alcohol consumption with the use of illicit drugs. So clearly a huge amount of intelligence to help to inform the review report to be considered by the Scottish Parliament. And the authors of the final report have summarised this all very well, in my opinion, in their detailed report, as well as their summary briefings. And it includes this visual. Now, it's very text heavy, but I think it's really nice because it maps that evidence across 40 studies to the theory of change that was developed at the start of this whole process many years ago. And based on the synthesis and the relative strengths and limitations of the different studies, Claire Beeston, who led the whole MUP evaluation, and MESAS, concluded that overall, the evidence supports that MUP has had a positive impact on health outcomes, including alcohol-related health inequalities. And the Director of Public Health Science at Public Health Scotland provided explicit support for the continuation of MUP beyond April 2024, even though that recommendation wasn't explicitly stated within the report. And delighted to say continuation of the policy was voted for by the Scottish Parliament. And so it now sits firmly in Scotland's statute book. In addition, during that parliamentary debate, and owing to the fact that 50 pence today buys you a lot less than what it did in 2018, the Scottish Government has proposed an increase of the minimum unit pricing to 65 pence per unit, drawing on some additional econometric modelling that the team at Sheffield have done. And this proposal to increase the MUP will be debated in October later this year. So a nice happy ending of the story, you may think, but of course not everybody agreed with the conclusions from the evaluation, and somewhat expectedly there was a backlash by some quarters within Scotland and across the UK, with accusations of the findings being spun and the evaluation being selective, biased, misleading or flawed. That was a direct quote. Now, we'd become quite used to this over the years, but one Conservative member of the Scottish Parliament lodged an official complaint to the UK Stats Authority, which led to the requirement to update the at-the-glance summary of the report, as well as the Scottish Government's press release. But otherwise, aside from those changes, which were specifically about how we communicated uncertainty, the interpretations and the conclusions were judged to be sound. And so the story continues, and my presentation is just about to end. I thought I would offer just a couple of reflections on my experience, which I've shared through a couple of commentaries with Nick Taylor and Sarah, who's on the panel today. So my first main reflection is that, just to be absolutely unambiguous, MUP offers an effective approach to reduce population consumption and related health harms. However, it is not a panacea. It's undoubtedly necessary as part of a policy toolkit, but it's not sufficient. And we've seen with some of the apparent unintended consequences at the individual level that there needs to be additional strategies for different types of harms that people might be experiencing. Another reflection is that natural experiments of this type are really messy. And if you're undertaking an evaluation that deliberately sets out to find unintended consequences, and which includes a range of diverse studies with diverse data and diverse methods, one has to be comfortable with the messiness of trying to bring all that together, because there will be conflicting evidence in there. And finally, I'll just say that embedding evaluation in the policy process is absolutely critical. The MUP evaluation has been rightly lauded for its transparent, rigorous, and theory-based approach. This was partly enabled through the sunset clause being in the legislation, but also through a government that had already established the context for thorough evaluation to be the norm and not the exception. And yeah, I mean, I've played a relatively small part in this story. There are a huge number of other people who played much greater parts, whose names are on the screen now. I thank them for their guidance and leadership through the whole process and for contributing to the evaluation. And yeah, if anyone has any questions, I'd love to take them. These are some things that I wasn't able to talk about because I didn't have enough time, but which might prompt some thinking in terms of formulating a question to ask. Thanks very much.
Thank you so much, Mark. That was a fantastic presentation with a huge amount of work distilled into a really engaging presentation. And I'm going to be really excited to hear from Sarah about MUP in Australia as well. So I'll just get you to stop sharing your screen. Perfect. And Sarah, you've got your camera on. Great. So hi, Sarah. Welcome and thank you for joining us. So before we get into questions from the audience, do you have any reflections that you would like to offer on Mark's presentation?
Yeah, first of all, just to add to the acknowledgements of country earlier, I'm currently on the unceded lands of the Wurundjeri people. I'd like to thank Mark for that presentation, so thorough, because it's such a that journey to getting that legislation passed, and then the massive amount of work to assess how it all went, putting that in such a clear way. I'm very impressed with the amount of stuff you just presented. I was sort of thinking as I was listening, thinking about the same sort of conclusions that you were actually talking about at the end, about being careful to not confuse the idea that minimum unit pricing can be a really helpful tool with minimum unit pricing could be a silver bullet, that it can, fix everything, that, all of our problems that we have with alcohol. And I think that the findings from the evaluation really reflected that. Because I think that, like you said, the evaluation found that the enforcement was good, the impact on prices was good, and, those chronic harms, what we're starting to see there was looking really promising, but there was those, those odd findings around the acute kind of, hospital harms. And I have two cats having a fight next to me. They have scared each other and left, sorry. But also in particular, those findings about some, negative impacts on those, more dependent and heavier drinkers. And I think that in the same way that we can't say that a minimum unit price is going to sort of solve all those problems. That also can't be the metric by which we judge it, but that we do need to be very aware, because these are very serious problems with real implications for the people involved, and that, yeah, looking into how we can supplement a minimum unit price to ensure that those harms are reduced, and and coming up with some solutions for those people, because at the moment I wouldn't say that without a minimum unit price those things are going great anyway, and also probably the difficulty in separating that from rising poverty and inequality, because that's where a lot of these problems are stemming from as well, but with the acknowledgement that an MUP could exacerbate that, but that also because if you then bring it back to like sort of that prevention paradox, where the people who are experiencing the most harms, those aren't the people who are experiencing the most harms at the population level, because there's so many more moderate and heavy drinkers who aren't dealing with dependence, and so there is so much scope for improvement and reduction of particularly those more chronic harms from an MUP, but that we need to be aware of making sure that we're doing everything we can for the people at that pointy end as well, because they are so important. And so I think that but the thing that I found really hopeful about it is that what the focus on having such a strong evidence base, because I think without that, maybe some of those findings wouldn't have come through, and the importance of coming at it from different angles. So rather than just having those reports, which can probably really well cover, sort of the big population level stuff, but it was a lot of the qualitative stuff that highlighted a lot of those issues and how important they are. And so I think it's really good to see what a strong evidence base is coming through, and how critical it is of, how well focused it is on not just highlighting the strengths, but also those things that can be improved upon and fixed in the future, which I found just really promising. And I'd love to think that Australia would look at doing something similar, but let's see. Yes, let's see. But yeah, so they were my main thoughts from today's presentation, but thanks so much. I thought it was great.
Thanks, Sarah. I actually sort of on that point had a very broad question as someone who doesn't have much of a policy background at all. With that really comprehensive, proactive evaluation sort of schematic that was laid out before the policy came in, is that common in public health policy making? Do we have that kind of thing in Australia when policies are changed like that?
I mean, I can speak to my experience in Scotland. So the framework for action on alcohol, so that came at a time when there was a new administration governing Scotland. So the Scottish National Party had been voted in. They were following a Labour administration which had been rightly heralded for bringing in the ban on smoking in public places. So the SNP were obviously looking for their kind of flagship health policy. There was a crescendo of evidence all pointing to alcohol as being a major issue that Scotland had to grapple with. And the SNP administration had also moved at that time to an outcomes-focused planning approach to all of its sort of policies across government. And so the stars just kind of aligned, and they actually commissioned NHS Health Scotland. This was just prior to when I joined them, to work with them to develop logic models and use evidence to understand, okay, if we are to do something serious about alcohol at the population level and at the individual level, what are the outcomes we're trying to achieve? And back mapping using evidence, what are the actions that we need to implement? And that's how that process came about, and why that framework was so important in the history of Scotland's alcohol policy, including MUP, although that took a while to come to fruition. But there were other important policies in there: National Programme for Alcohol Brief Interventions, for example, and the ban on multi-buy promotions as well. And when I moved to Australia, having evaluated the ban on multi-buy promotions, I forgot just how prevalent promotional activity was in alcohol retailers prior to that legislation coming in. So when I came to Queensland and there was drive-through bottle-os and then just like promotions everywhere, I was really confronted by it, because that environmental context had just changed in Scotland due to that policy.
Amazing. We've actually got a lot of audience questions, so I might move straight to those so that we can get to them. Russell has asked whether you can comment on the findings in Sharkey's recent paper in Drug and Alcohol Dependence that wastewater analysis shows that the reductions in consumption resulting from the NT's MUP were mostly eroded over 1 year. Sarah, maybe did you want to take that question first?
I haven't seen that exact paper. I find the wastewater stuff really exciting and promising, but I'm also kind of keen to see how that would look when triangulated with other measures of consumption. But it certainly points to the importance of keeping track of how this will all work and how well it is working. Absolutely.
Yeah, and if I just come in there, so obviously the MUP and NT has been evaluated, so it's there's been 2 evaluations undertaken to look at the impact of MUP in the Northern Territory. Triangulation was a word on my mind when Sarah started to answer the question, so I think what the MESAS programme of work and the MUP evaluation has shown is the importance of triangulation in order to get a comprehensive picture of a policy's effect. I did read that paper. I think it's been co-authored by colleagues here at the University of Queensland. I can't remember the details of it, but I think, as Sarah said, if you just introduce a minimum unit price and then just leave the price set at that one price, then obviously over time, as prices increase, the amount of alcohol being affected by that price is going to erode over time. So whether that's the reason for that, I'm not sure. Nick Taylor has commented on the importance of, I guess, attaching minimum unit pricing to some sort of index of inflation so that it increases relative to the increase in other household prices.
That actually links well to another question from Molly. She says, thanks for a great presentation. Curious if you can speak more to how the specific MUP of 50 pence and now the proposed 65 was determined. And is there a MUP, the highest that you think could be reasonably set? Like what's the highest?
Yeah, good question. So, I mean, I cannot understate, I cannot overstate enough how important the University of Sheffield modelling was to this whole policy process. And there's great evidence which reinforces that through qualitative interviews with policymakers and so on. So the team at Sheffield used a priori scenario modelling using econometric and epidemiological modelling techniques to assess what the estimated impact of different minimum unit prices would be. And based on the interpretation of that, the Scottish Government decided that 50 pence per unit would be the price that they would go at. That was back in 2012, all that evidence was generated, but they stuck with that, even though the policy wasn't implemented until many years later. There are pros and cons to going too high, of course. So I think what we've demonstrated and discussed is that there can be unintended consequences of raising the price of alcohol for those who are dependent on alcohol, and particularly those who are financially vulnerable. And so that has to be a really thoughtful consideration when it comes to what the price that the alcohol should be set at. But I think that modelling work is really important for helping to guide some of those discussions.
You've actually again linked to another question really well, so I'm going to go to that one.
I wish I was meaning it. That was so good.
This one is from an anonymous attendee who is also a fellow Scot. Do you have any more to say about the findings you mentioned regarding the impact MUP has had on people purchasing essentials like food and housing?
Well, I guess it's just to say and to reinforce that this really came through from the qualitative studies. So we identified this as being a potential adverse consequence of minimum unit pricing before we designed the evaluation. Again, recognising that it's not every policy has some unintended consequences. So by identifying those prior to the evaluation, we were able to design studies that specifically tried to find out whether or not this was a consequence. And for some individuals in some circumstances, then that was found to be the case. There was no evidence to suggest that it was happening at a kind of population level. And so I think these unintended consequences shouldn't, I guess, I think as Colin Angus put it, be used to beat the policy with a stick with. It's just to recognise that overall the policy had its intended effect on health harms, but it's very important to use this type of evidence to support those who might have been adversely affected by the policy, who probably need additional funding and support anyway. Yeah.
And perhaps this is a question that you can both weigh in on. This is a question from Bridget. She asks, with such messy data, what was the media coverage like? I wonder if both of you can comment on dealing with media when you're working in alcohol policy research.
Sure. So I once did a presentation in Scotland called Dancing with the Media, and it was about my experience of this. It was messy. So like the data, it was messy and it was mixed. Generally speaking, of the, let's say, the more reputable media outlets, the coverage was accurate, and we had a very strong comms team who were able to ensure that journalists were using the press release that we put out there. But of course, it's been very high profile for a long time, and there's a lot of organisations and individuals with vested interests who just rubbish and try and diminish the findings that you're presenting. So yeah, it was quite mixed depending on what newspaper you like to read.
Yeah, I think you know, it's a constant issue regardless of the, you know, exact policy in question. You know, and on the whole, you know, things can go pretty well. And often it's more just it's less of a sort of concerted effort to throw a spanner in the works and more an accidental one on behalf of whoever's interviewing you that can get you sometimes. But yeah, the way in which you know, some more some maybe bad faith actors are not treated as such can be a bit frustrating, and can also mean that sometimes, you know, it can make it more difficult to discuss more genuine concerns in a realistic way. So yeah, but I don't have any hopeful tips or anything about that. Sorry.
That's okay. There are just so many questions. Everyone's so engaged. This is actually a question that I also was wondering about, as to when you're talking about sort of a best buy and increasing the price of alcohol, when do you sort of choose between an MUP threshold and and implementing like a tax? Is that a really broad question?
No, it's a good question, and it's a question that came up a lot during the legal challenges on minimum unit pricing. Well, why doesn't Scotland just increase the duty on alcohol? Of course, Scotland doesn't have the economic powers to do that as part of its
Right.
as part of being a member of the United Kingdom. So that was one reason why that couldn't be done within Scotland. But more generally, the team at Sheffield, again using their Sheffield alcohol policy model, did compare the impact of different types of alcohol tax versus minimum unit pricing. And they did find that a tax based on the volume of alcohol in drinks would help to obtain the public health benefits that alcohol control policies are trying to achieve. But the MUP was particularly good at targeting the more kind of harmful drinkers, and particularly good at narrowing alcohol-related health inequities.
I think in the Australian context, it'd be really interesting to see, and I think there's research on this out there, but I can't remember it off the top of my head, but if that gap is a lot smaller here, because if you are talking about cheap alcohol, you are nearly always talking about wine, and switching to a volumetric tax on wine, I think would the difference between that and a minimum unit price for us, I think, would be much smaller than it would be for in Scotland, where there were a couple of different products that were falling under the levels that were being discussed. But when we're talking about $1 or even $1.30, $1.30 is starting to get some beer creeping in there. But I mean, on the whole, it's just wine. And so I do think that it wouldn't necessarily be the same in Australia, or at least that difference would be smaller.
I think, unfortunately, we will have to wrap up the webinar there. But Mark, I think you shared your email address on your slide. So hopefully if people have any questions, they can contact you. So thank you again, Mark and Sarah. It's been such an interesting and informative discussion. And thanks to everyone in the audience for asking so many questions and being so engaged. Before we bring the webinar to a close, I'd just like to let you know about our upcoming webinars. The NDARC series. Laura, do you have the slide? Okay. I think the next one might actually not be until the 13th. Oh, 13th of June. I was right. Which is called Resource Landscapes for Young People Leaving Residential Alcohol and Drug Services by a fellow Centre for Alcohol Policy Research at La Trobe, Dr. Gabrielle Colazzi. So we'll see you back again in the NDARC webinar series in 2 weeks' time. I hope you all have a great afternoon. Thank you for joining us.